Did you know that $30 billion in federal benefits goes unclaimed every year? Today we're talking about 5 major benefits that you or your loved ones might be missing out on, and how you can make sure that you're not leaving money on the table. We're going to cover benefits for families, seniors, and children today, so stay tuned. Let's start with one that's close to my heart: access to affordable healthcare for kids through the Children's Health Insurance Program, or CHIP program. This is different from your usual Medicaid, and that's an important distinction because more than 14 million families lost Medicaid when they started unwinding those pandemic-era waivers in recent years, and a lot of families didn't realize that there might be other programs they might be eligible for. CHIP offers low-cost or free health insurance for children, and it covers everything from doctor visits and dental care to prescriptions. The program is designed to help families whose income is too high for Medicaid, but who still can't afford private insurance. CHIP is designed to fill that gap for families who earn too much for Medicaid but still need help with healthcare costs. It's possible that your kids qualify for CHIP even if you lost your Medicaid coverage recently. This is personal for me because I know several families who went through this. They were cut off unexpectedly and struggled without coverage for months. But the good news is that after they reapplied, they got their benefits back through CHIP and their kids are now covered again. So if your family lost Medicaid recently or you're struggling with healthcare costs, now is the time to check if you're eligible for CHIP. Don't assume that you're locked out of help. You may qualify and not even know it. In fact, a lot of those Medicaid removals were done for technical reasons, and you may still be eligible for that as well. But you can visit your state's CHIP or Medicaid website to apply and find out what you're eligible for. If you need help with the application process, you can contact your local health office. And it's not just kids who can save either. If you're on Medicare, you might be paying way more than you need to. Over 3 million people who qualify for Medicare savings programs are not enrolled in those. And that means that they're leaving between $2.5 billion and $6 billion in unclaimed benefits on the table every year. Medicare savings programs can put more than $2,100 a year back into your budget on average. Most people save $175 a month or more through these programs. That's because they're designed to help low-income individuals cover Medicare Part A and Part B premiums, deductibles, coinsurance, and copayments, costs that can really add up, especially if you're on a fixed income. But too many people don't know about these programs or think that they won't qualify. Sometimes seniors assume these benefits are only for extremely low-income individuals or think that their assets might disqualify them, but that's not always the case. Depending on your state, even if you have a modest savings, you still might qualify. There are different levels of Medicare savings programs, such as the Qualified Medicare Beneficiary Program, which can cover your Part B premiums and reduce your out-of-pocket costs at the doctor or hospital. Other programs like SLMB and QI can help with premiums for those who have slightly higher incomes. If you're on Medicare, take a few minutes to check your eligibility. You can apply through your state's Medicare office or online, and it could save you hundreds or even thousands of dollars every year. Your state health insurance assistance program may also be able to help you navigate this. So feel free to give them a call at 877-839-2675 or visit shiphelp.org. So I'm curious, if you're using Medicare, are you currently enrolled in a Medicare savings program? Let me know your experience in the comments. Now, we've talked about support for seniors and children, but for now, let's focus on a program that offers a crucial lifeline to people of all ages with disabilities: Supplemental Security Income, or SSI. Sadly, many who desperately need this support are missing out. Studies indicate that only about half of those who qualify for SSI are actually receiving it. That means that over 1 million people are struggling unnecessarily. SSI isn't just for adults. Children with disabilities can also qualify, ensuring that they have the resources they need to thrive. But alarmingly, recent reports show a significant drop in the number of children who are receiving SSI benefits, and that's a sign that many eligible kids might be slipping through the cracks. Another study showed that around 1 million older adults may be eligible and missing out as well. So for those who qualify, SSI offers monthly payments to help cover essential living expenses. I'll show the latest maximum payments here on the screen, but please remember that the exact amount that you'll receive depends on your income, family situation, where you live, and so on. And while that benefit amount may vary, every bit can make a difference when it comes to covering your costs. Some states also offer an SSI supplement. That's an additional financial assistance amount paid on top of the federal benefit. These state supplements can significantly boost your monthly payment, but they aren't available everywhere. For example, states like Arizona, Arkansas, Mississippi, North Dakota, Tennessee, West Virginia, and some territories like the Northern Mariana Islands don't offer this extra assistance. The rest of them seem to have some sort of supplemental program, but again, the details on that will vary. Now, if you or someone you know might be eligible, it's important to apply. Even if you think your income is too high or you don't meet the criteria, the rules around SSI can be more flexible than you might expect. The Social Security Administration website, ssa.gov, is your one-stop shop for information, and they can even help you start the application process. If you have questions or need assistance, the SSA is always just a phone call away, so don't hesitate to reach out to them. And remember, if you also want to apply for Social Security disability benefits, called SSDI, our sponsor Injury Claims can help you with that. Just click the link in the description below or visit lirlinks.com and click the button that says Get Help Applying for Disability Benefits. Now let's talk about some programs that can help you with your food budget. Rising food costs are putting a dent in everyone's wallets, so let's explore some ways that you can get help with that as well. Now, we all know that a healthy meal can make all the difference in a child's ability to focus, learn, and thrive in school. And that's why the free and reduced price school meals program exists. But shockingly, an estimated 20% or 1 in 5 eligible students aren't taking advantage of this essential benefit that they're eligible for. Many parents don't realize that they can qualify for this program, especially if their income is higher than what they assume the cutoff might be. Some people wrongly assume that they need to be unemployed or experiencing some sort of extreme hardship to qualify. Other families may be worried about the stigma attached to receiving free meals, which keeps some children from participating even though they do qualify. It's important to remember that this process is confidential and the benefits are significant. Not only does it ensure that your child has access to healthy meals, but it can also ease the financial burden on your family. If you're not sure whether or not your family qualifies, it's easy to find out. Contact your child's school or visit the district's website for information on how to apply. Many school districts now have simplified, confidential application forms that make it easy for parents to apply. Now, I know we talk a lot about SNAP benefits on this channel as well, but did you know that 63% of eligible seniors aren't using SNAP? That's $6 billion worth of unclaimed food benefits every year, and it's money that could be helping you or someone you know put healthy food on the table. Now, many seniors don't realize that they qualify for SNAP. A lot of people assume that it's just for families with children, or they think that their retirement disqualifies them in some way. Others may worry about the stigma of using food assistance, or they find the application process confusing. But here's the thing. SNAP is designed for anyone who needs help affording groceries, including seniors on fixed incomes. In fact, there are some accessory programs like ESAP that make it easier for seniors to get and keep those benefits when they apply. Now, for seniors, SNAP can provide monthly funds for groceries, helping to stretch tight budgets and make sure that you have access to healthy, nutritious food. It's especially helpful when other expenses like medication, housing, and utilities are on the rise. Now, the average SNAP benefit for seniors might seem modest, but over the course of the year, it can make a significant difference in managing your grocery bills. Even if you only get the absolute minimum $23 a month, that's still $276 a year, and it also unlocks all of the other incredible benefits that come with having an EBT card. You can automatically qualify for programs like Lifeline and even get some incredible EBT discounts like half off Amazon Prime. You can get the scoop on all those deals at lowincomerelief.com/EBT. In fact, there is a special tool that was built to help seniors make sure they're getting all the benefits they qualify for. It's called the NCOA Benefits Checkup. It's run by the National Council of Aging, and you can find it at benefitscheckup.org. Please go check it out. And don't forget to check out our other videos for more ways that you can save money and get free stuff. I'll see you there.